The study today under the title of Examining the Impact of Upright and Recumbent Positions on Labor Outcomes in Saudi Arabia as a quasi-experiment. As we know, helping the woman to adopt a comfortable position during childbirth significantly affects labor changes and the pain management. So there is a lack of consensus on the impacts of different childbirth positions on labor outcomes. In addition, scarce of studies have assessed the effects of upright and recumbent position and delivery outcomes, especially in Saudi Arabia. So, from this point, the objective of this study to examine and compare the influence of upright and recumbent positions during childbirth on the birth outcomes. The methodology of this study about setting, it was conducted at the childbirth unit at East Jeddah Hospital from November 2020 up to March 2021. For the design, as mentioned, it's a quasi-experimental, including 300 women in labor between 18 up to 45 years old. For the sample, the recruitment started from initial size like 325. 300 of them was totally eligible to be complete this study. And then they are divided into two equal groups. 150 for the study group and 150 for the comparison group. On the other hand, the 25 cases which excluded from the study, it's excluded for the following cases, like 15 of them have meconium stained liquor, 5 received bethidine, and 3 withdrawal, and 2 have a language barrier, so they couldn't complete the study with us. For the tools that used in this study, we used the structured interviewing questionnaire and the modified partograph according to World Health Organization and the Wong-Baker FACES to record the pain score, the pain labor pain. For statistical analysis, the study included descriptive statistics, chi-square, independent t-test, and paired t-tests. For data collection, after obtaining all approval from the institution, the recruitment was based on the inclusion criteria, then the division into 2 groups, and then the interviewing conducting with the women who will be included in the study. And the first stage of labor, both groups was follow the routine care of the hospital for this, and then for the experimental group, the investigator applied the upright positions with them according to their choices, and for the other group or the comparison group, the investigator leave them to be under the recumbent position as the usual. This is the usual position in the hospital. Come to the result, the experimental group mean age was between 32.20 years old compared with 30.50, which is very close to each other. And the main result here that the woman in recumbent position, which is in the comparison group for this study, they spent a longer duration in the first, second, and third stages of childbirth. Also, they had higher pain scores and less satisfaction with the assumed positions. And on the other hand, this effect not happened to the woman in the upright position or was less than the woman in recumbent position, which make a high significant difference. The p-value was less than 1.001. Okay. Come to the conclusion of the study. The laboring women in upright positions in this study experienced the following. faster progress of labor, shorter duration of childbirth, less pain, and higher satisfaction with those assumed recumbent position. This study serves an input for midwives and nurses to enable them to offer appropriate advice to improve intrapartum care, encourage applying of educational program, and this is the recommendation for this study to encourage applying educational program targeting pregnant women about the to let them learn about the positive impact on women's birth experience of the upright position. Thank you.